Hi there. Today I'm going to show you how to write a referral letter or a courtesy letter. So the first thing we need to do is to go into the patient case. So I click in the appointment, go into clinical notes. From here, we're going to see the notes, clinical notes, and we have the letters tab. So in the letter we have lots of templates. We have a referral letter and a courtesy letter. The difference is the referral letter is for the GPs that have referred the patient directly to us or to Square One, and it's a letter back. The courtesy letter is for their GP that they might not be aware they're coming to physio. They haven't recommended the physio, therefore, and we just want, as a courtesy, let them know that what the patient is doing. Why do we do letters? Well, letters are an important part of our way of communication with other practitioners and just keeping everyone involved, focusing on that patient-centered care. It has different benefits. One thing is it gives the other practitioners a peace of mind that we know what the diagnosis is and we know what we're doing. We're providing the right management for them. It also helps the communication for when the patient goes back to their GP. They don't need to tell every single thing that they are doing with us because the GP already will know that they're coming to us. It's also a good way to keep the other practitioners up to date with the progress. So we have progress letters, we have specialist letters, and so on. So writing letters is part of being a physio, and we make it simple here with lots of templates. And I'll show you some tricks today. So in this case, I saw this patient Wednesday. I'm going to write a referral letter with you guys. So there is a template, so I'm going to select letterhead, date, and address. So the first thing I need to know is who the GP is. There are different ways of knowing. One of them is going to the patient form. Every time a patient comes in as a new patient, they will fill a new patient form, and we ask in that form who the GP is. So in this case, I know that the patient didn't provide that GP detail. So other patients will, so this is where you can find the GP. But I knew that the doctor has sent a letter to us, a referral letter. So I know who the doctor is, so I can go select here, other contact, and I just put the last name. And here's the doctor. So we have a database of most of the doctors in the Lower North Shore. So you will find most of them. If you don't find the GP you're looking for, just talk to our reception team and they can enter the details for you. But you can always write a letter when you have the time, and then you can add the doctor after. Another way of finding who the doctor is by asking the patient. So when you use the new patient the templates for your clinical notes, it actually prompts you to ask for that, and that's what I did as well. And when you get your new patient register, new client register updated, admin is going to tell you who the GP is. So many ways of finding who the GP is. If somehow you cannot find it and you're writing your letter, as reception, they can always call the patient for you and find the details, or you can leave a note on a NUCAL, and next time the patient comes in, admin could ask them or you could ask them. So the important thing is that we communicate and we find what we need. So then select a sender. It's going to be me. And because it's a template, it's very easy to follow. All what's in bracket is already automatic, so you don't need to write anything. But what I'm going to say is that my co-presented complaining of right posterior leg pain in close to the ischial tuberosity, of gradual onset for the past I think it was 4 months. So you can actually go back to your notes and start reading what the patient told you. Gradon said since December 2020. And you can add more detail if it's relevant, but what you want to put there is the location of pain and any presentation, if there was trauma, if it was gradual onset, if it's highly irritable, anything, but keep it brief. Then the examination, we have 3 bullet dots, and we want to point the 3 main findings that will lead to a conclusion, a diagnosis. So for example, Michael presented with tenderness on palpation, on the right ischial tuberosity near the hamstring insertion, which was a very clear finding for me. Another finding was pain and weakness during single leg raise. Yep. And then another finding was weakness on right single leg bridge. Okay. And resisted hamstring curl. So usually you want to provide some information about range of motion, about palpation, about clinical testing, which are the main things that we use to come with a diagnosis. Of course, I did more of that in terms of testing. I assessed the lumbar spine, forward flexion. I did the single leg raise, the tenderness, and the bridging, and other things that I didn't point here that were negative, but I cleared the hip, I cleared the lumbar spine, and so on. I did double leg bridge, for example, as well. And you don't need to put everything in there. As I say, you just put the key 3 or 4 things that will lead to a conclusion. Plus, remember that the subjective history is going to give you a lot of information regarding the possible diagnosis. So what we do in the objective examination is just confirm with a couple of testing. In an ideal world where things are very clear and straightforward, of course. So my provisional diagnosis was a right proximal hamstring tendinopathy. Yep. So my treatment usually involves 3 topics: education, manual therapy or hands-on, and exercise. And then I put some details in education. I could put regarding diagnosis and management, and I can put do's and don'ts. For example, don't stretch, don't sit on firm surfaces, keep active, all of the do's and don'ts. Manual therapy, in that case, I did soft tissue releases and trigger point releases. But you can also put taping, dry needling, joint mobilization, and passive stretches, any manual therapy. And the key thing for me is the gradual exercise program for tendon loading, for hamstring tendon loading. Okay, and I can put, you can put more detail. You can put using MedBridge app or in-house one-on-one in our studio, so you can add more detail, but today I'm going to keep it simple for the purpose of showing you how to do a letter. And then some prognosis. I anticipate Michael will make good progress under our care, and will be able to return to sports, which is football, within, say, 4 months, for example. So that's clear. So to sum up, what do we need to do? At the GP, at who is sending it, put some information about the location, irritability levels, onset, 3 key findings, objective findings that will lead to a diagnosis. Put a diagnosis. If you're not sure, actually just put a question mark. You don't need to know everything, or just check with the other physios before you send the letter, but just put something that will make sense. And then 3 main areas of treatment, and then a prognosis. And then you need to sign it, but I'll show you a trick. What I do, instead of typing all my qualifications, I'm just going to go into send email. And for example, here, an email. And I'm going to copy and paste my email and my qualification. Copy. You could also have that saved in a Word document somewhere. So then, edit, paste. I don't have to write things all the time. Well, that didn't work as I wanted. Okay, so then I'll see if I can align that. No. Okay. And I put it in bold. So that's how you save your letter. Oh, sorry, that's how you name your letter. If you want to copy another professional, this is where we put, say you want to send it to another doctor, you can add a contact and you can search Dr. Dan, for example, and you can add another contact for a copy. Okay, for example, that, and then you save. Okay, save, and that will appear there. If you don't like it, you delete it. So it's very straightforward. The more you use it, the quicker it gets. Then how do we save this letter? So we have a system here. So you put the full last name on capitals, then the name with the initial on capital, then the date you wrote the letter, then the doctor you are sending the letter, Dr. Lily. So that way, anyone who sees this letter saved are going to know that that's the patient, that's the date, and that's the doctor. And what I do, and I'll show you another trick, I copy this, and I go and compose an email to reception. And I put, say, please print and send. And I say, hi guys, la la la, please print and send, edit, paste. And that's how I send my email to reception. So then when reception sees this email, they know where the letter is, who is for, and you send it. So here, going back to the letter, you just need to save everything you do. And the letter is going to appear. Here you can have a little look. So it's the right patient, the right doctor. There's not typos. It all looks quite, just be careful with the typos. I don't type very well, but I always make sure I review that because that can create a first impression that is not the best. So write nice and tidy. And then, for example, here, this is in a different font. So I should go and edit and make it look nice. So that shows that you actually took the time to write to them. People can be a bit sensitive about these things, so you can change the case here, default. Okay, so this is what you do on your when you have a white space in the diary. So I need to go back and fix that, but that's what you do. And then to find that letter, it's gonna be in documents under the case. So anytime you just go back to the diary, back to your patient, back to the clinical notes, and you'll see the letter. So you can save it as a draft, or you can complete it as well. So if I go here again to Michael, clinical notes, documents, and here's Michael's letter. So PT is patient new form, and then when you see something that looks like this, I know that this is a letter sent by the GP to us on this date. So that's why it's important to name the letter the right way. So it's very easy to follow who wrote it, when, and for who. And then you can save them in different folders and so on. So I hope that all made sense. Go and have a look and apply with your letters, and we can chat more in our meetings. Thank you.